Honorable Samateh, the Director of Health Services, Dr. Bite, the Director of Pharmaceutical Services, Ramani Sabali, Deputy Director of Health Services, CMD, EFSTH, and we also have the Deputy Executive Director of MCA and then Registrar of the Pharmacy Council, Mr. Malgay. Colleagues from the media, we want to welcome all of you to this important first briefing in which the Honorable Minister will give an update in relation to Aki, and we'll also have a question and answer session. And as usual, when the Minister made a statement, we also follow it with a question and answer session. And I want that, as usual, how we have been doing it, we make it so organized that at least everybody will understand why we are here. So we listen to each other, we take our time, and we ask the questions that we are asking, and for sure you'll get the right response for the people who matter are all here. So you get the right, and all the questions doesn't mean that will be directed to the minister, but when you just raise your question and then where it will be answered, it will be answered to your satisfaction. On that note, I now invite the Honorable Minister of Health, Honorable Samateh, to give his statement, but also we'll do it in such a way that the first part will be English language, because we want the general understanding of the entire population, so it will also be in local languages after the English summary. Thank you.
Thank you very much, Mr. Chair. Good evening, colleagues. Good evening, ladies and gentlemen of the media. We are gathered here today, this evening, to have a press briefing with regards to the acute kidney injury cases in the country that we've been seeing in the recent past, even though we are still seeing them. And equally speaking, to have interactions with the media so that the people of this country, our beloved country, know what is happening. But we first of all start by extending our deepest condolences to the families who lost their loved ones to acute kidney injury in the Gambia in the past almost 3 months. It has been a very difficult period for the families. It has been a very difficult period for the whole country. It has been a very difficult period for the health workers. It has been a very difficult period for His Excellency, the President, and his entire government. This is a phenomenon we had never seen in this country before. And it has stretched us very far and stretched us to the limit. To the families, we say, we share your sorrow, we share your sadness, we share your sleepless nights. And may the Almighty Allah grant the loved ones that have passed away at Jannatul Firdaus, and may Allah give you the fortitude to bear the loss. I must say, this includes my own family. I lost a nephew to acute kidney injury on Wednesday. This shows that no one is exempt when there are health disasters, when there are health emergencies. As long as we are all human beings, health emergencies concern us all. At this juncture, I would like to mention here, we thank His Excellency, the President of the Republic, Mr. Adam Barrow, for coming out yesterday to engage the people of his country in the presidential statement, which goes to extend condolences to the families, which equally indicated the situation of acute kidney injury in the Gambia, equally what had transpired with regards to the occurrences of the cases, what had also transpired with regards to the care and attention the patients had received, what had also transpired with regards to the investigations until we were able to have a direction as to the possible cause of acute kidney injury, the acute kidney injury in the children, and what his government had done, is doing, and will be doing. However, at this juncture, the statement by His Excellency, the President, with regards to the statistics, was by no means intended to be insensitive. He was actually portraying the disease trend, explaining to the people of this country a new phenomenon that we had not seen, but it was by no means meant to be insensitive. And we have realized that some people took offense in that paragraph, and we wish to sincerely apologize for that paragraph. And as his advisors, we take full responsibility of that statement. The intention was to explain to the people of the country the disease pattern, but not to be insensitive to the loss of lives in the country. As he emphasized, loss of a single life is one too many. It is never the wish of any leader, whether it's a leader of a compound, a leader of a town or a village, or a leader of a nation, to lose a single life in his country, compound, or household. And as a parent, His Excellency the President feels your pain. He feels the loss of loved ones. He has had a personal experience of that in the past, a number of years ago, and he knows how it feels to lose a son or daughter at a tender age. The welfare of this country, the welfare of the citizenry of this country, is His Excellency's topmost priority, and he will continue to endeavor to ensure that the people of this country receive the best. And the provision of the healthcare services of this country, ensuring that the people get the best of care, has been very high on his agenda. The hospital, before and even during this AKI outbreak, has received a lot of support as the physicians, the doctors, and the nurses, and all the support staff tried to support these children who were sick, His Excellency's government was at the forefront providing support, providing medical equipment. Items were brought in very, very urgently within short notices to ensure these patients get the best of care. Within the last 2 months, 9 hemodialysis machines have been bought. 2 of them are specifically for children. We've never had specific hemodialysis machines for children, and we can say a lot has been done, and we thank His Excellency for the support. We thank the doctors at the Edward Francis Small Teaching Hospital, the nurses, the laboratory scientists, the pharmacists, all the caregivers at the Edward Francis Small Teaching Hospital who participated in the treatment of these patients. Acute kidney injury, as we are aware, is a very devastating illness, even in adults, talk less of in children. We had elaborated on the possible causes. As we mentioned earlier, initially, the thought was that it's a bacterial infection that was causing it, in addition to the diarrhea and vomiting that these patients presented with. But as we looked at the trend, we realized that many of these children had also been given drugs, and a pattern became clearer. And with the experience of the experts we have at Edward Francis Small Teaching Hospital, that enhanced our clinical acumen to pick these cases at the point they were picked. We had to do quite a lot at the hospital, but a lot could also not be done in the country because this is a developing country. We do not have all the resources. But I must tell you that government is doing all what we can do to ensure that this country gets all the resources that are required to deal with such cases. It has not been easy, but I wish to extend His Excellency's unflinching commitment to ensure that the health facilities of this country are the best in the region. To further expand his commitment to the health facilities of this country, he ensures that his family obtains health services from the Edward Francis Small Teaching Hospital. His own daughter was admitted there, and the First Lady was with the daughter there for a number of days, just like any other mother and a child. His mother also was admitted there and received treatment from that place. That shows that he doesn't belittle our system, but he shows his commitment to the system, and he says whatever is good for the people of the country is good for his family. Whatever is bad for the people of the country is also bad for his family. So just to emphasize the commitment. To the bereaved families, His Excellency has put up a high-powered delegation who will be meeting with them, who will pay a condolence visit and update them on the steps government is taking. We want to tell you equally that as we speak, there has been engagements of our diplomatic representatives so that the country of origin, which is India, of the drugs that have been found to be contaminated, so that they are engaged in the usual way when such things happen. We also want to inform you that the police has already started work. The officials of the Medicines Control Agency and the importers of these drugs have already been invited to the police headquarters to help the police in further investigations. The license of the importer of the drugs, under the instruction of His Excellency, has been suspended as we speak to you. We have seen that the outbreak of acute kidney injury is contained now. We are no longer seeing many cases, and that is a good sign of containment. The total number of patients who had acute kidney injury as we speak is 81, and on receiving the mortality figures from Senegal as well, where some of the patients were taken to, we now have a total mortality of 69. Distinguished ladies and gentlemen, this is a very difficult time for the entire country. This is a very difficult time, a time that needs us to work together as a nation, a time that needs us to support the health workers, continue the investigations, because the investigations of these causes of death or the cause of death of these children is not concluded yet, because there are a lot of other things that need to be done to know exactly the cause of death, the cause of acute kidney injury, and the cause of death of these children, even though we highly suspect the contaminated medicinal products. Our epidemiologists and other health workers are working with teams from the WHO, World Health Organization, and the Center for Disease Control in America. And amongst them, we have anthropologists and epidemiologists who have vast experience in issues of such nature. And these individuals are all working with our teams to ensure that the investigations yield results that government can act on decisively. We assure you that government will do whatever is possible, inshallah, to get to the root of this, and decisive actions will be taken based on the findings. In a related development, the World Bank has pledged to help the Gambia put up a drug quality laboratory, a food and drug quality laboratory, so that we do not see these kinds of problems again in the future in this country. Some of the challenges we face as a developing country because of the poor resources. The Gambia has similar challenges to other developing countries. Many of us do not have quality laboratories to test these drugs on regular basis. This is a challenge even in some of our bigger neighbors, where some of the samples were sent and they couldn't do it all until we all had to send some samples to other countries. And even with that, there are certain tests that actually take time, because if the contaminant is known or there is a suspected contaminant, it is easier to check if that actually is contained in the sample that you have sent. But if the contaminant is not known at all, they have to test it and match it along with so many other possible toxic contaminants, potential contaminants, and that takes time even in the very advanced countries. The other tests are still also being continued. That is, the isolates, the bacterial isolates from these individuals are also still being tested. Sequencing is being done so that at the end of the day, we can put all these together to get to know the root cause of the acute kidney injury in these children. Once again, I want to appeal to the country, the Gambia, the country that we all share, the country that we are all related, in which we are all related to each other, the country which is the only one we have, the country that we need to build together, the country that we need to develop together. We appeal to each and every one of us to see country first. We work together so that we identify the challenges and we build our nation together. This is a time of sadness. It is a time we should support each other as a country. It is a time we should look for the problems, because we as a country are a victim of this problem. These contaminated drugs were not manufactured here. Nobody ever knew or thought that anyone will think of bringing in contaminated drugs that have the potential of causing harm to individuals, talk less of loss of life. So as a country, We are all victims in this. No government, no president, no minister, no director, no mother, no father, no brother, nobody ever wants this to happen in his country. So that means this is a time when the country should come together and we see what can we do to avert such problems in the future. What can we do to strengthen our systems? We talk to the partners. Partners have started listening to us. We had been talking before, but we didn't have the resources to have a quality lab here. In fact, we had taken steps to ensure that all medicines in this country are registered. All the importers had been given deadlines. But of course, that had to go with robust quality assurance systems, where we had gaps because we are a low-income country with very little resources. Once again, we wish to say to the families, government is aware of your pain. His Excellency, the President, is aware of your pain, and we all stand by you. Inshallah, we'll get to the root cause of this. Inshallah, it will never happen again in this country. We thank you very much for your kind attention.
Excellent. Excellent statement, Honorable Minister. Thank you very much. We have listened to the statement of the Honorable Minister, and now we go into the next phase, which is the question and answer session. Now you will tell me if you want to ask anything. You just raise up your hand. Tell me who you are and which media house do you come from. Then from there, then you can ask your question. Then I'll take that 5 at a time. 5 at a time. Yes, you are. Party Network. Okay. Okay. And who else? Landing.
Yes.
Okay.
Freelance.
Freelance.
Yeah.
But attached to which newspaper?
Starting.
Start. Who else again?
I'm from the Edward Francis Teaching Hospital, Medan City.
You want to ask a question? So you are part of the family.
I'm also part of the family.
Okay, then you don't need to ask. So you can give suggestions and recommendations. Maybe perhaps you can tell us what you are doing at the FSTH. I'll give you that chance. Who else again want to ask? That's all. Good. So, Father Network, you're allowed to give one main question. Well, you know time is late, and then we want to definitely wrap up as quickly as possible, if that is okay with you.
Yes, fine.
Please, kindly ask your question.
Well, thank you very much, Dr. Samateh, for delivering the statement. And my question is, contrary to the WHO report, your ministry issued a press release indicating that 28 children died out of the acute kidney injury. And then Gambians were never alerted about this until the WHO reports are brought about 66, which actually shocked the nation. And tell us what happened, your ministry, for them not to detect these 66 until WHO and what organization was involved.
Okay. Let's go to the next one. You have Landing.
Yes. Landing season, Kerfan. My question is, the president authorized for the suspension of the Lansing import, the owner of the Lansing who imported the medicine to the country. We want to know under whose Lansing these medicines are imported in the country.
Thank you. Under whose Lansing?
Under whose Lansing?
Thank you.
And then my second question
No,
is...
Landing, no. You are breaking the rules one at a time.
Seriously?
Yeah, no, you are breaking the rules one at a time. Okay? Then you have Star TV.
Good evening, Honorable Minister. In 2020, you faced the National Assembly discussion about the ghost account, which was not addressed well. Earlier this year, we had the sniper cases too, which is still under the Ministry of Health. Today, we are discussing about 66 children died of avoidable death. Is your ministry or is your administration prepared to elevate, improve, and also restore the health of Gambians?
Okay. Thank you. Okay. And I will respond to a lot of foreign network with regards to the 28.
Yeah. Thank you very much for the question. I think it is important to first and foremost mention to you that the figure the WHO quoted was our figure. It's from here. It's not from them. The way WHO works, in the country, we have a WHO office, which is headed by we call him WR, that's the WHO resident representative, who is part and parcel of our incident management team meetings. He has been with us, and this data is presented to that meeting in Kotu on regular basis. There is a presentation of the admissions, the mortality, and whatever is being done for these patients. And a line list is developed, which will tell you the patient, the age, the address, the sex, and then what was taken, the parameters for comparison. And these figures, as they went up, they were actually no secret. They were presented to that meeting, and on a regular basis, the WHO resident representative sent those reports to his bosses in Afro, that's the WHO Regional Office for Africa, in Brazzaville, and to Geneva. We were all working on this together. They sent in experts on our request. Because when countries have such emergencies, that's the work of WHO, that's the mandate, international health. Initially, an expert was sent in called the RED, that's the Regional Emergency Director, who is based in Afro, that's the Regional Office for Africa, was sent in. He spent a few days with us here. That was followed by the director responsible for pharmaceuticals and medical supplies of WHO. So we worked with them. So the information WHO came out with was our information. They supported us to do the laboratory tests because of their mandate and their networks. They know which labs can do what tests in the whole world. That's part of their mandate. And they also support countries by conveying the lab samples to these required laboratories. And WHO did that for us in the whole of this process. Some samples were sent to Senegal, then to Ghana, all coordinated by WHO, and then to Geneva, Switzerland, and also to France. Now, when we got the preliminary results, as you are aware, we acted here. We said there should be household recall because the preliminary results for those drugs did indicate that there were contaminants. And we say, even if it is not confirmed, we are going to withdraw them from the households. But we had suspended them, the drugs. We did so when there are challenges like this, there are international best practices. What you do, then what you do next, then what you do next. These are all best practices that have been outlined by international systems. So when that happened, initially, you remember, we said suspension of paracetamol, promethazine. Thereafter, there was quarantining of stocks. Thereafter, there was withdrawal, and then the household withdrawal, and so on and so forth. As we waited, even with the preliminary results, we said we needed to withdraw them because there was some indication, but it was not confirmed because the lab needed to be sure, because these are very, very serious things. Excuse me. Now, as we awaited the confirmatory results, the WHO went ahead to announce. And I must tell you, the WHO Regional Director for Africa and his team, her team, and the WHO country representative extended the message to me apologizing because that was not the protocol, the correct protocol. The correct protocol was for us to get the laboratory result as a country, and we come up with an announcement. That is the correct protocol. The WHO team in Gambia and Brazzaville extended their apology because the protocol was for the country to have been notified of the results so that we take immediate action by informing our own citizenry. Then we, WHO, can take that, then we notify the WHO that this is what we have in Gambia, and WHO notifies the world. So the WHO Director General, I'm afraid, did not follow the protocol, and his team themselves thought that was not correct, and they called me to apologize. This is the pattern.
Thank you.
Thank you.
Thank you very much. Now we go to the suspension from landing, the suspension of the launching. What next? I hope the importer, whether that's the case. Information around the suspension of the launching of the importer. Under whose name? Under whose launching, yeah.
Yes.
Under whose launching.
Thank you very much. The license that was suspended was under the instruction of His Excellency, and the Medicines Control Agency has the mandate, and the document, I'm sure you will see it somewhere, the suspended license. The Pharmacy Council, Medicines Control Agency people are here. That's why we brought them. Our apologies, we did not introduce the members of the panel, but introduce yourself so that when we pass the questions, you will know who is answering your question. Yeah.
Yes, I am the registrar of the Pharmacy Council.
I'm the Deputy Executive Director of Medicines Control Agency.
Yeah.
Myself, Samateh Sow.
Babandi Sawali, Director of National Pharmaceutical Services.
Yes, you have to.
Oh, yeah. My name is Morinja, Director of Health Promotion. Initially, I did the introduction.
Oh.
Okay.
So, and then I introduced them, and but
Okay,
now
you
can
did, okay.
You can able to get their names if you want to ask.
Dr. Amar Jafari, Chief Medical Director at Edward Francis Teaching Hospital.
That's good.
I'm Dr. Mamoudou Kenya, Deputy Director of Health Services.
Yeah, Mustafa Abite, Director of Health Service.
And they also have Deputy Director of Health Promotion is also there.
I'm Health Promotion Director.
I think.
So I think Madam Fatuja can answer your question. She is there in charge. They suspended that.
The license holder is Safe Kennedy.
Safe Kennedy.
Yes.
Chef.
Safe Kennedy.
SAIT.
It's pharmacist. The pharmacist and the boss is your registrar.
Okay. So
Maybe I can make a clarification.
Okay.
Please.
Go ahead.
You allow me. The license.
We need the sound. Can we?
You want the sound?
Yes, yes.
Okay. Why don't I finish your second question?
Then you can
move.
turn the mic.
No problem.
Is that fine?
Yes.
Now, your question was,
The improvement, what plans?
in 2020, we made an announcement at the National Assembly. Sometimes from the outside, you might not notice the improvement. But believe me, the mindset of the Ministry of Health has changed for the better with regards to corruption and accountability. We have closed a whole lot of loopholes. Why you do hear a lot of noise about Dr. Samateh every day, criticisms and so on, is because we are blocking the areas where money is lost or stolen. When you stop people from stealing, you are not their friend, you are not popular. That is why you hear every now and then. I'm sure it puzzles you. Why are these people always against this man? What has he done? What I have done is I said, let people not take government money that doesn't belong to them. That is what I've done. Now the latest one, the last few months, you know what I did extra with my team? What we did in the last 6-7 months? We said our officials will no longer be given interest of hundreds of thousands of dollars to put in bags to go and implement activities, and the officials will serve as paymasters. We said health workers should do health work. We are not cashiers, we are not accountants, we are not paymasters. If people are supposed to be trained, let them provide their phone number, their names, bank account details, and BBAN, that's the BBAN numbers of the banks, and the office we call Project Coordination Unit transfers the monies directly to their accounts. Of course, this has earned me a lot of enemies, because now the interest that were being siphoned is no longer happening. So I think that's a big plus from that time. And this is why in the last 6-7 months, there's a lot of noise against me. But I think we are doing that for the best of the country. And what has that gained us as a ministry and as a country? It has gained us partner respect. The World Bank, UNICEF, WHO, Global Fund, UNDP, they all value and respect us to such a level. That is why they are giving us the resources to do what we are doing now. As a country, we have, during COVID, you've heard of big countries that have had challenges with oxygen. We also had challenges with oxygen. But as I speak to you, we got 4 oxygen plants in this country. 2 arrived this week. And all these 4 were bought by partners. All these 4 were bought by partners, and they brought them down to us. We have a waste management system in the country, clinical waste management treatment center in the country for the very first time. We have 7 incinerators for clinical waste across the length and breadth of this country. We have 4 refrigerated medical waste trucks so that medical waste are no longer transported in open trucks and then medical waste falling in the streets and flies roaming over them. We are building a 104-bed emergency treatment center at Farato, modern, which is going to get 20 standard ICU beds. It's going to get a new blood transfusion center, a new public health laboratory, and a conference center for the Ministry of Health. We have upgraded Deban Health Center, Deban facility in Bakau, and equipped it to be able to accommodate patients who have COVID. Now it is used as the emergency center. We are renovating and modernizing Edward Francis Small Teaching Hospital. We are renovating and modernizing the polyclinic. We are doing procedures in the country that were never been done here before, including laparoscopic surgery. We are doing endoscopic procedures here now, which all used to be done in Senegal. We used to send patients to Senegal. We are doing postgraduate training. Medical doctors are now specializing in surgery, obstetrics and gynecology, internal medicine, pediatrics and family medicine right here in Edward Francis Small Teaching Hospital. We have started a dental school. Now we are training dentists. We are training midwives to bachelor's level now. We are training nurse anesthetists to bachelor's level. We will soon start, with the help of World Bank, a school of pharmacy. We have expanded the community health nurses school in Mansakonko. You've seen the new structures. We have expanded, built new structures for the state enrolled nurses school in Bansang. We are currently building 6 new health centers across the length and breadth of this country. We have brought in 90 ambulances in the last 2 years. 80 of them are the community ambulances that have changed the lives of the people who live off the main roads, to get them to health facilities for easy delivery. Maternal mortality is going down in this country. The trend of it going down is so rapid. We are currently building 8 COVID-19 treatment centers across the length and breadth of this country. We are renovating 50 health facilities in this country. We have built 5 health posts in Busumbala, Brikama Welingara, Tampoto, Makumbaya, and Brikama Nyambai. And we are about to build another 13 of such facilities. So we can go on and on and on. And how come we are able to do all this? It is because of accountability and transparency. So partners value us, and they are coming forward to give us the resources to be able to do this, because they have seen our commitment, our love for country, our honesty, because that is very crucial. And as we speak to you, when these kidney injury issues came, the World Bank came forward. They've started, in fact, the advertisement is now on for assessment to design a new drug and food testing laboratory for this country. That is currently going on as I speak to you. Within these 2-3 days we have done that. So I think a lot has happened. And this trend, inshallah, will continue for the people of this country.
Thank you. I think I want to make, yes, like, I want to go to new ones now.
So why not we allow him to
Yes,
clarify that,
yes,
we can come back to
that's
the
fine.
minister.
Yes,
Because
go ahead, go ahead.
important.
It's important, yes. Go ahead.
Yes.
Yes. Okay, why? Come and sit here. Come, bring your seat.
You can just stand there.
No, you can bring your seat, and then you can. In fact, we can have another seat here.
Yeah. Then.
Whoever is supposed to come and answer can. Yeah.
Sniper.
No, sniper. Yes, I'll get to it. Yes.
Yes, I think the clarification I wanted to make is this. You see, in pharmacy practice, we don't license the professional. We license the premises. That is the practice, business. So I think, just the clarification, I think the intention was, we wanted to know who is the supervisor. Because in this case, it is the professional that we register to practice. So each professional that is registered by the council is issued a certificate of practice. And in the case of, in the case of importation, it is the supervisor, who is, who is the practitioner who now becomes the supervisor. So in this case, the license holder, in the language of pharmacy, would rather be the supervisor, and not, talking about the license holder, because here we are licensing the premises. So that's the clarification that I just wanted to make.
Okay, since you are from pharmaceutical department,
wait, let's take it in order. Please, let's take it in order.
So, but
others
he's
want
going,
to ask,
so I just
is
have
it in line with
question.
you want to ask the same question about pharmacy?
Yes.
If yes, can you go ahead? Nande, you have to wait. Thank you.
Thank you very much. My name is Aisha Kuli from Diamond Talents TV. made mention of you guys give licenses to professionals. What are some of the procedures that it's required, in terms of issuing this license to professionals?
Well, on the side of Pharmacy Council, we have 3 categories of premises that we license. We license the wholesalers, meaning the distribution outlets. Now, for you to be able to qualify or to be able to acquire the license for a distribution outlet, you have to, employ the services of a pharmacist. So that pharmacist will now become your supervisor for that premises. It means all the professional requirements as far as pharmacy practice is concerned, it is that pharmacist who will have to take the lead, right? If it's a retail or a community pharmacy, again, you will need to hire the services of a pharmacist. Then if it's a drugstore, then you will have to hire the services of a pharmacy technician or another category, what we call a nurse dispenser. But all these people, are supposed to pass through the Pharmacy Council, and they are registered and issued with a certificate to practice, right?
Colleague, you are okay with that? You are fine? Satisfied?
Yeah.
Thank you very much.
Yes.
No, you have already got your chances. I'm going to do new ones now. Any other one who want to, Madam Fati, you want to ask? From Standard, you want to ask?
Yes.
Okay, go ahead.
Follow-up question from what Landi asked.
Yes.
My name is Memra from the Standard. I just want to know, for how long has this manufacturer store in India has been supplying the Gambia?
I think that one was very fast.
Okay, Madam can come forward and Madam kindly come forward. Yeah, thank you. No, Landing, no. Landing, I'm the chair. So I'm in control, huh? When I'm in Pelfato, you are in control. So, no, don't worry, no. Babuga, please. Please, Babuga. Yes, no, it's okay, please.
Please, can you come again with your question?
No problem, ma'am.
Maimuna, can you repeat your question again?
Yes. My question is, for how long has this manufacturer store in India has been supplying the Gambia?
For your information, this maiden pharmaceutical company is only working with Atlantic Pharmaceutical Company in the Gambia, only with one company. Within the past 3 to 4 years, only Atlantic Pharmaceutical Company. Yes, please.
So when you were aware, sorry, I'm fully money, Alcamba Times. So when you were aware about this.
Sorry.
Yes.
Did you get the permission to speak?
Sorry, madam.
No, because
that is my hand.
Are you satisfied with your answer?
Yes, thank you, ma'am.
Thank you very much. Now further you can come in.
You said they are working with only one pharmacy. So when you were aware about this thing,
what thing?
That they are working with one pharmacy. I think that's what you said. What is the name of the pharmacy?
Maiden Pharmaceuticals in India.
Yes.
They are working only with Atlantic Pharmaceuticals in the Gambia.
Okay. So when you were aware about this thing?
What thing?
About they are working with one pharmacy.
Yes.
So what was your reaction about as a medical council? Because we understand that just today that these people, the medicine that they are bringing here, it is coming only in the Gambia. So the suspicions must be there already. So what was your reaction when you know that these people are sending to only this pharmacy?
Thank you for the question. But let me tell you, all over the world, there is what is known as branding. There is Yeta Jalot cooking oil. You have sugars, you have butters. All of them are branded. This one is your product also. It's not only them. You have other pharmaceutical business people who are in the field who also have their own products, like City Pharmacy. The products they are bringing is only for City Pharmacy. EMJ Pharmaceuticals, the products they are bringing in is only for EMJ. It's not only them. They brand their products. Thank you.
Thank you very much. Now, Landing, I'll get back to you. One question, and that's your last question, Landing.
Okay.
Thank you.
Seriously?
Yes.
All right. Is it true that Mr. Setkebe rented his line seat?
There is nothing like renting.
Yes. Is it true that Mr. Said Kemi rented his licensee to these people as claimed by various people? And then, if this is true, and other rented licenses as well, if these are two scenarios, is this a good practice?
Well, thank you very much for the question. All that I want to say first is that we don't rent our licenses as pharmacists. We are supervising pharmacists, and we work with partners as supervising pharmacists. We don't rent out licenses. No, not at all. That's a wrong word. Renting of license is a wrong word. We work with them in partnership. You are the financiers. I am the other one with the technical know-how. You don't have the technical know-how, and I don't have the finances. Then we partner together and work together. And you take me as your supervising pharmacist, but we don't rent out our license.
Okay. Good. Further network, last one.
Okay, no
for you too.
Okay, thank you very much once again. And in 2020, we were talking about the maternal mortality death. And here we're talking about the death of 66 children. And recently, we have seen health ministers resigning from their position due to some weak performances in that ministry. And where we are, you are just 1 year to the next 5 years. What will happen if the health ministry continues to face certain constraints that the ministry is facing at this moment? We see Dr. Samateh resigning from his position.
Thank you very much for that question. But before I come there, let me answer the sniper question, which I missed when he asked.
Yeah.
Actually, the sniper issue was also equally concerning to the Ministry of Health.
Yeah.
But I think it's important for us to also understand actually that the Foods Authority, Foods Quality Assurance Authority, is not under the Ministry of Health. It's not. So our mandate, we work with them, we partner with them, but they are not under us. So people were misrepresenting that fact. What's the Ministry of Health doing? What's the Ministry of Health doing about this and that and that? And our team was working with them to support them, especially our public health team was working with them. And that's what it used to be under the ministry. That unit used to be under the ministry many years ago. But our mandate doesn't extend over them now. We can only work with them and support each other when the issues come. Now, coming back to my good friend here, first of all, let me address the issue of maternal mortality. Maternal mortality in this country has been going down. It has been going down. The figures are, in 2013, there was what we call the demographic health survey. That time, the figure of maternal mortality in this country was 433 per 100,000 live births. A similar process was repeated, a demographic health survey, 2019-2020, maternal mortality came down to 289 per 100,000 live births. After that, and currently, as we speak, because surveys are done after a few years, usually, you look at the trend. But even before surveys, we have what we call service data. And the service data has shown maternal mortality this year at 178. That is a big decline. That is a big plus for this country. And to tell you the truth, ours is the lowest in the sub-region. You can check it out yourself. Our strategies are working. It's not easy. You see, the loss of one life is never easy. It's not easy for the health workers. It's not easy for the family. No doctor, no health worker, no nurse wants to be involved in the treatment of an individual and the person dies. It's devastating for the health workers. There are nights that we don't sleep because we've lost a patient. There are nights that we cry as well because we lost a patient.
All health workers want whatever patient they touch, the patient walks home and they see the patient again. So maternal mortality is equally a very distressful thing for us. But we are doing all what we can to continue to bring it down. And we have seen the trajectories. We have seen the pluses, the improvements. You've seen the figures and you can check it. Ours is the lowest in the sub-region. There are countries in the sub-region with very high figures. You can check for yourself. Now, our strategies are many. One of them, the community ambulances. In this country, before the arrival of these community ambulances, pregnant women were carried to hospitals on donkey carts, 7 kilometers, with water, stagnant water on the roads. We have had incidences of wolves attacking a pregnant woman being carried to a hospital on a donkey cart. We've had a similar incident of a pregnant woman being carried on a horse cart and wolves attacked them. Even the horse itself was so afraid it couldn't stop. It was running. You can imagine a pregnant woman at the back of a horse cart and the horse running at full speed away from wolves. We have seen pregnant women in labor being carried on motorbikes to a health facility. We have heard of stories, women go into labor at night and the family tells them, well, you have to wait till morning because there's no vehicle sleeping in that village. And sometimes that labor would have been an obstructed labor and the woman in pain from day to night, from night to morning. His Excellency said, no, we have to do something about this. Let's get ambulances that will sleep in these communities so that when a woman is in labor, they can call an ambulance that can go to their home to pick the woman, no risk of wolves. They get to hospital in time. I think that's a big plus. And this is a big innovation in this country. Our neighbors are not doing it. Other West African countries are not doing it. Other African countries. So this is unique. It's a unique innovation in Gambia. So really a whole lot is happening in the health sector. Now, with regards to me resigning, I first of all ask you, why do you want me to resign? Why? What benefit will my resignation make? What difference? Now, if you say, Dr. Samateh, why are you not resigning? And a lot of other people are saying, Dr. Samateh, please don't resign. As I'm getting a lot of calls today, I think some people had even speculated that I resigned. And so many people called, why are you resigning? Don't resign. You are the best person for this job. You can do it. You've been doing it. You're moving things forward. You are doing this and that and that. So whose instruction should I take? If you are to advise. But I think the bottom line is, if I resign, you know I'm a competent surgeon. I can have a lot to do. And so it is not personal. It is not people wanting to stick to jobs. Resignation is an easy way out. There are problems, a lot of challenges. Then you throw the towel into the works. I'm walking off. You can go and deal with the problems that we all know we are dealing with. We are working together to resolve. And if you equally look at, sometimes you balance it. If you want a symbolic resignation, oh, he has gone because, you said maternal mortality is high. Of course, it's going down. So he's gone, maternal mortality is going down, he's gone, and so on and so forth. But I think that is not the essence. Then you compare this man, what has he been able to bring to this country? What has he been able to do for the health sector? Even people who do not like me, they know I have done very, very well for this sector. They know it. The mindset of the sector with regards to accountability has changed. There are things that people no longer think of in the Ministry of Health because they say that man is there, he's so. Even that mindset alone is good. Yesterday, I was going to JRTS to be part of a panel discussion. A gentleman called me. He said, "Is it Dr. Samateh?" I said, "Yes." He said to me, "I never supported you." I said, "Well, thank you." So he said, "But today I'm calling you to thank you." I said, "What is the issue?" He said, "For your stance with your team to first of all work very hard to identify a problem in our country, to identify that there is a problem in children, to work together to isolate bacteria, to work together to see a pattern in the death or in the arrival of this patient to hospital, in the death of these children, to suspect drugs, to suspend these drugs, to withdraw these drugs, to test the drugs, and to come up with initial evidence." He said that is a big step for our country, because all these things could have been missed and all these things could have been worse. The situation could have been worsened. This trend could have continued if not for the hard work of our team. And quite a lot of people, contrary to what some people say, quite a lot of people think with our limited resources, with our limited material and human resources, with our limited capacity as a country, we did very well to detect this and to come out transparently to the public, to say to them we have a problem in our country, to say to them we have seen the trend, it is not usual, and to be able to suspend the drugs and to be able to contain the outbreak. Believe me, I'm not saying it because I'm health minister. You can ask anyone independently. I think the team did our best. Thank you.
Thank you.
Thank you very much. We've now come to the end of this session.
Mr. Yeh,
And we can discuss it further.
No, Mr. Yeh,
People are some people are traveling. Some people are traveling. No, some people are traveling.
No, I know you should allow us to ask questions.
Wait.
You are also a press conference. We all know that we are coming from far.
No, wait, landing.
Can I?
You asked 2 questions. I think you should be happy. Others are asking 1 question.
I'm
Let them
not
also have.
satisfied.
No, wait. You will be satisfied. You'll be satisfied, landing. Please. You are the same people who will complain that we keep you here for long. I've been getting complaints from, especially you.
No.
Yes.
That is when you say.
So let's agree now. Let's agree now. We'll just go to the final. Let me also give him chance and give her a chance, and then we are done. The other one we can further discuss them later. Thank you. No, landing. Wait, landing.
So we have questions.
Landing, please. Landing. When I say please, I mean please. Thank you, Madam Coley. No, wait, Madam Coley first, and then you can.
Okay. I have a follow-up question with regards to what Mrs. just said in terms of, do you guys normally often go to these pharmacies in terms of checking some of these drugs, whether they, and then having the equipment needed in terms of checking whether they are false, they are real or not? Because at times, most of the people nowadays will be complaining of, I went and bought medicine to this place, but then it's not good. So how often do the medicine control agency go out in terms of seeing some of these drugs?
Thank you, Madam, for the question.
Madam, you can just go ahead. You have the same question on relation to that? Okay. How about you? The same? Okay, then if that's different, then just wait until it's done.
Thank you, Madam, for the question. I want to tell you that we have a unit at the Medicines Control Agency known as the Inspectorate Unit, where we have inspectors. That's the central level inspectors. We have not got inspectors yet in the regions, but our inspectors go out quarterly to these regions. We also have the Pharmacy Council inspectors in the regions. We work together. We go out to do routine inspection from time to time. We go to these pharmacies, we go to the drug stores and any other outlet to inspect these drugs. We go to do post-marketing surveillance. We go for physical inspection and visual inspection. If there is a product defect, we pick it from the field, take it to our store. We do investigative inspection. If we have a tip-off, we move out to go and investigate, follow it up until we close the case. Day before yesterday, we were in Kasa in Foni. We got a tip-off information about the farmers. Our inspectors were there to close it. You understand? We have an inspectorate unit and we go out to do the work.
Thank you very much.
Okay.
Star?
Yeah, I have a suggestion and a question. If you would allow me to go with the two, or I go with the question only.
Can you take one because it's late?
The suggestion could
The
be
shared one.
The suggestion could be helpful to the country.
Yeah, just then give us the suggestion.
But the question also is very
No, that cannot be possible.
I beg your indulgence to please give a suggestion that would help.
Okay, no problem. You know, time. It's the same people who will complain about time. That's my problem.
I came from Brooklyn.
No, it's okay. Then go ahead.
Okay, the suggestion is: can the government be a central supplier to all of these drugs, where the government will inspect these drugs, and then there will be nothing like having a second party that will be doing this to avoid the case of Setkebe, as mentioned here. If the government is a central receiver of these drugs from any company, we would avoid having poisonous drugs in our system, to thereby calling on the ACI, which is the order of the day today, or any other condition that could be as a result of poisonous from the drugs. The question there would be: we have seen in neonatal mortality and also infant mortality getting rise from the presence as which what he said, 60% not variance to what has been happening. This would have indicated that there are lots of infant mortality or neonatal mortality. Will you attend this? And secondly, are you ready to say you are sorry that this came as a result of avoidable error? If enough materials were in place, these poisonous drugs should not be circulated in the community. So I will be taking this as is an error from the health department, and also is the government prepared to have a quality laboratory where to test these drugs? Because I've not been seeing any quality laboratory in the country here. The Gambia is in 50s going to 60. Still, we don't have independent or standard laboratory where we could do this test, than depending on other countries.
Thank you very much.
Yeah, I can take that. Yeah, thank you very much. I think your suggestion is well noted. The entire drug procurement system is going to be reviewed. We'll be coming into health. We'll be coming into being of the health insurance system scheme in the Gambia. The way drugs are even brought to even public hospitals is going to be centralized. And it's going to, well, it's centralized now, but there's going to be an improvement whereby they are going to, we're going to form, just like it happens in Rwanda. We have already started that process. The other process you mentioned is happening in one or two neighboring countries,
yes.
and that is what we plan to do. You know, I think the truth of the matter is nation building is not easy. You didn't meet all this in place, and you do them as time goes on. Not everything is doable in one day. We didn't meet all this in place as a government, but we want to do them. You spoke about we are grossly saddened by the loss of lives. These are our own family members. We are all family members. And as health professionals, as people entrusted with the provision of health services to our country, we are devastated, I must tell you. It has been one of the most difficult periods for any of us. Very little sleep, under a lot of stress every day. We get saddened. And this also includes the president himself. Each time he is giving a briefing on this issue, you could see he feels really, really sad. But there are challenges of availability of resources. We wish the Gambia had all this before now, but the resources are not enough. To get a good quality lab that can do most of these tests costs millions of dollars. We didn't meet them. It's not available. We had planned, we had talked to partners, but the resources are not forthcoming. But now, after a sad incident, of course, very sad, partners have shown indications to support. So as I mentioned to you, World Bank is already advertising for people to send in letters of interest for the design of quality food and drug lab for this country. Because we think it has happened with drugs today, we need to think about the foods as well. We shouldn't just do for the drugs. Sorry. Yeah.
The food was tested on sniper.
So you see, so now so we said we need to have a comprehensive food and drug laboratory for our country. So we're doing that. Now, when you also asked about what government is doing, it escaped my mind to say that we did mention to you the Farato Hospital is going to be the modern teaching hospital of 1,500 beds. The president announced it, and that process has started. The first phase is the phase of the emergency center, but the second phase, inshallah, very soon, we will equally start the construction of an open heart surgery center and a center for kidney transplantation. Already, we have got funding for that, and they are looking at putting the designs together. We are equally, very soon, inshallah, we are looking for land now to start the construction of a new hospital in Brikama. We got funding for that, and a new hospital in Basse as well. We already got funding for that. These last two are from the World Bank. The first, the kidney transplantation and open heart surgery centers from support from the German government. So there is a lot of goodwill towards the health sector. Inshallah, we'll be able to move it to where we want to move it to.
Thank you very much. Madam, who are you and where do you come from? Ghana 24. Okay.
My question is, since it is stated that somebody else's license was used to do this process, does the ministry have a committee that do a follow-up on the licensing of professionals to avoid such incidents?
So Medicines Control Agency comes, yes.
Yeah, you can face them. Yeah, you can.
Yeah, but I think it was already
I'm sorry, yes.
I think clarification has already been provided.
Yeah.
Should I go there?
Yeah, you can go there and please repeat the clarification. Landing, I'll give you a final chance.
Yes, thank you so much for your question. I was saying that already clarification was given that, it is not individuals that are licensed. So the license is for Atlantic Pharmaceuticals, right? I think that clarification is already there.
Yeah.
So talking about your issue, whether we are going to look at the issue of registration and so on, I think the Honorable Minister has said it here, and also the President has also said it yesterday, that both the Pharmacy Council Act and the Medicines and Related Products Act will be reviewed. And some of those issues, will come in during the review, and as a country, we'll see how appropriately we look at those issues.
Thank you. Thank you. Thank you very much. Landing, your final question.
Okay.
And it's going to be one question. Now you choose. You have three there.
I actually have three.
No, you choose one.
I choose one.
Yes, please.
Okay, no problem. Honorable, in your deliberation, you said the country, does not have the capacity to test these medicines. That's what you said. It is correct, is it not, that Gambians are consuming medicines that they don't know whether it will harm them, since the country doesn't have the capacity to test this medicine?
Okay. Actually, if you extrapolate it to foods, we don't test the foods, the rice we eat, and we consume it. I think the issue is, first of all, when people are supposed to supply whatever, it should be wholesome, it should be good. So if they supply what is not good, it's criminal. It's criminal. So that's the starting point. When we all go to buy things, we expect it to be good. But of course, for medicines, when they are bringing them, the team is there here. They come with what they call certificate of analysis. Certificate of analysis. Now that certificate of analysis gives the details of what is there, and only that. If the certificate of analysis, that is like certificate of authenticity of the medicine. So that document should qualify for that medicine to be consumed. Without the certificate of analysis, I'm sure they will never allow those medicines to be sold. So the certificate of analysis should be authentic. But of course, you have in the world people who do things differently, causing problems for everybody, which is sad. So in that case, countries need to have the capacity to be able to check if such people want to do things to your country, to your people, you are able to detect it. But because of our low income status, developing country, we haven't been able to get all this. Since independence, we didn't have them. We didn't inherit it. These structures. But as we build the nation, we've been working hard, talking to partners to do exactly that, to get these structures. But sadly, very sadly, before we got to that level, this thing happened. So this is the problem. So we need to, what we need to do is to strengthen the system, to strengthen what we need to do, to engage partners, because we did even say identifying certain contaminants in medicines, even in developed countries. If they don't suspect it, they go and test now, they might not see. Because of the methods used, when you suspect it, it's easy, you can go and check. But if it is, could anybody have put in some kind of contaminant? That is why when some samples were even sent to Switzerland, we were told we couldn't get them in less than 2 weeks. It is beyond 2 weeks that we can get them. Because if you identify, if you have particular contaminants in mind, ethylene glycol, diethylene glycol, they could go specifically to test for those. But if you just suspect that it could be contaminated, you didn't have anything in mind, that means they have to check it against all possible contaminants of the world, which is technically very difficult even for developed countries. But we hope to build capacity as a nation, as our nation grows. Our nation is growing, is developing. It's not easy to be a low-income country. You face challenges. People take advantage of that. So that is why we said the whole country, we are all victims in this, that our country was virtually assaulted with this. And then the government is going to leave no stone unturned to, inshallah, ensure that we get to the root cause of this. Sometimes in governance, certain details are not mentioned at certain points. And the reasons are not because anybody wants to hide anything, but it preempts the actions. It preempts the actions, and sometimes it affects investigations. It jeopardizes investigations. That is why sometimes you think you are not getting enough information. But really, government is open and transparent, and we will endeavor to furnish you with all the information in a transparent way as you follow the processes. Inshallah, we'll get to the root of this, and decisive actions will be taken.
Thank you very much. Thank you very much.
Cases from this year and about 10 years ago. Do you allow me to speak? There was infant mortality that happened in the Gambia here, which was camouflaged with meningitis. It was confused. That was treated by it was treated like a malaria. Then it took a while before it was realized. So if the Ministry of Health is able to detect this at an early time and is reduced to two patients assistants from the specialists that I've seen, doctors took about 12 hours a day to work on addressing these issues. This is laudable. This is a great effort from your department. We hope this will continue, but we will also hope that there be a standard quality laboratory in the country here, and also a standard approach to address unforeseen circumstances. As you will put this, prevention is better than cure. If we are able to prevent it, we will not suffer when treating these cases. Thank you so much.
Thank you very much.
Thank you so much for that.
Thank you very much.
Thank you very much. And then definitely we've come to the end of the updates. And we want to thank the Honorable Minister for the time and energy taken to come and talk to the media at this last hour. And we are very grateful to him and the entire team. We are all happy, and we are happy that the media is also here on time. Once again, our apologies for inviting you here at the prompt time and everything.
He has a question?
Yeah.
See, one thing is very important for us to whenever we